I don't take nothing that a doctor don't prescribe. I just take Paxil, Xanax, Zoloft, Flomax, morphine, Valtrex, Flonase, Plavix, codeine, Zyrtec, Zoma, Zantac, Ultram, Zocor, Zipro, Prozac, dopamine, Demerol, Lexapro, Tylenol, Vicodin, Lyrica, Lipitor, and Adderall, but I don't do no drugs, man.
Hi, everyone. Welcome to our Fundamentals podcast series. This one is on hydration. And the reason we call it the fundamentals is because it's fundamental for your health. There's a lot of people coming to my clinic needing help with their health, and they have all these symptoms and they're not even doing the fundamentals right.
They want to go right into the most complex treatment plan they can think of.
And the fundamentals they might seem boring or common sense, but they really are the key to your health. And so I would advise you, before you seek out the help of a functional medicine practice, that you make sure you're doing the fundamentals right. And that will save you a lot of time and money. And so today's fundamental series podcast is going to be on hydration. Yes, it sounds very boring, doesn't it?
But it's not.
It's not.
If you could look at all the complex things that occur in your body, it's fascinating. And they all take water.
Yes. Every cellular reaction that takes place in your body, and there are thousands of them occurring right now throughout your body, all require water.
Every electrical impulse that goes through your body.
Everything requires water. Every system, every function, like I said, at the cellular level requires water. And there's a lot of people that, I need to drink more water. They think of it like that. Some people don't even think about drinking water, period. They're just walking around all day drinking coffee, colas, teas, and wondering why they feel so bad.
It's a mystery.
Oh, such a mystery. Let's
just walk through real quick some of the fascinating things that you have to have water to accomplish to make your body work properly.
And we do have notes. Paul tries to keep me on track, and I also have to have notes so I don't forget anything. So there are a lot of these that are going to, you're already going to know, but we'll go through them. So for those of you who have struggled losing weight, you got to be hydrated. The functions of the cellular reactions occurring at the mitochondrial level require water to function. Those mitochondria are the organelles in your cells that produce energy. And so if they don't have enough water, if those cells don't have enough water, you're not going to produce the energy you need. Things aren't going to work right in that department.
Often the hunger cue is a thirst cue.
True. Yeah, a lot of people think they're hungry when they're really just thirsty. Water also, of course, boosts exercise performance and recovery. For those of you who are active, athletes, you compete a lot, or maybe just, are working out in the yard all day long, realize that real quickly. When you drink water and you're hydrated, you feel better. Promotes optimal kidney function. That's a no-brainer. You need water to properly hydrate your lungs and your airway lining so that the mucus doesn't become too thick.
That's the same for your saliva.
Right. So when people are sick and they tell me that they're coughing up a lot, or they can't cough up a lot of mucus, I'm like, start drinking a lot of water right now, because it'll start thinning it out and it's easier to cough up.
And that saliva is the beginning of your digestion process.
Oh yeah, and saliva. When you get parched, you're not producing enough saliva. Well, saliva contains enzymes that start the digestive process in your mouth. So that's the first part of digestion takes place with saliva.
If you ever put that, I remember in elementary school, they had us put a cracker in our mouth and hold it. And within a few seconds, you could taste the sweetness because the enzymes were breaking down the simple carb and became a simple sugar. And that's
exactly
your digestion.
Then it also promotes, of course, proper GI function and elimination. People who aren't hydrated well tend to be constipated.
That's me.
Okay. To TMI. Of course, it helps maintain your blood pressure, regulates your body temperature. It acts as a cushion for your brain, spinal cord, and your joints.
I think the number one beauty tip you could give someone is hydration, because it changes your skin.
It really does. You can tell that people who are hydrated and are hydrating appropriately, their skin just kind of glows. And of course, there's other reasons too. They're probably eating well and sleeping well and other things like that. But hydration's a big one.
Yeah, you go out to Aspen. We vacation out in Colorado a lot, and these uber wealthy women, they don't look so good. I mean, that's why Southern women are the most beautiful women, is that the moisture here, but they're always dried out there.
Yeah, it's tough to keep up with the hydration demands at altitude and in dry climates.
And they get all that plastic surgery.
It does. I mean, and I can tell as soon as we're driving back from Colorado, I can tell when the air becomes more moist because my skin changes.
Well, you actually there's a waxy cuticle that develops over your skin when you live out in desert climes to protect yourself
from loss of
moisture. Yeah,
moisture.
There's a protective, but it's doesn't make you look very good.
You better wear your hats, is what I have to say. And then, of course, it improves oxygenation. Improves the immune system function, and it's required for detoxification. And there's lots of organs and systems involved in the detox process. It's not just your liver. There's detox process in your lungs, your skin, your kidneys, your liver, your intestinal tract. That's why it's not good to be constipated, because you're not going to be detoxing well. So again, drink water, help that detoxification process out.
It regulates your body temperature both ways. If you're dehydrated, you'll get the chills.
Right.
I've experienced that. Mountain climbing or skiing, you just can't stop shivering. You're dehydrated.
I've done that in the desert.
Mm-hmm. And then overheating, the same thing.
Right.
You can't cool yourself off because you don't have the fluids.
I've had heat exhaustion before as well because
it's
I
both
was
ways.
dehydrated. All right.
Lubricates the joints. You missed that one. Immune system.
No, I got that one.
All right.
You just didn't hear me.
All right. I don't listen. It's 55 to 60% of your body. So it's important to have good water.
Yeah, that's a big chunk of your body composition is made up of water. And of course it changes because with sex and age, your fat tissues don't have carry as much water as your muscle tissue. And so that's why men actually have more water weight than women, because you guys are more muscular than we are.
You're pretty buff.
Thank you.
You can go a month without food. How many days can you go without water? 2 to 4?
2 to 4, depending on the environment and circumstances.
That's amazing. You go a month without food.
Yeah, your body will start to shut down real quick without water.
Right.
And then, of course, there's the general rule of thumb for how much do you need. And there's a back and forth, and, half your body weight in ounces or about 64 ounces is the rule of thumb. I think there's a Bible verse that you found that basically corresponded exactly to this.
1/6 of a hen per day at set times. And I researched what a hen was, and I did 1/6. It was 64 ounces.
I guess that's maybe where they got that.
Well, and it said at set times, because we always talk about the office worker. They always seem to have the jumbo.
And they're just drinking it regardless.
Just sipping all day.
Just sipping all day. And if you're just sitting at a desk in a room that is, set at 72 degrees, I don't know, you're going to need as much water as somebody else. You might be overhydrating. And we'll talk about the ways if you are underhydrated or overhydrated.
But it also said at set times. I think it's important because you cannot catch up with water. If you get way behind, you can't just automatically get caught back up. It takes a while. But I also think it's important to drink a decent bolus of water at a time. I look at all, I'm a farmer also. All the animals drink a lot, 2, maybe 3 times a day. They're not sipping water. And I think that's good for flushing the kidneys. And I just don't think it's a good habit to be, I got my water bottle, I'm hydrating all day. It's like, whoever did that? If you think back historically, you took a water break. You worked in the fields, you were hunting, gathering, you were whatever you were doing. You didn't have a jug of water there, just sipping on it all the time. You took water breaks. Yep. So, and there are a lot of things that will impact your hydration needs, right? And some of these should be common sense. Of course, the environment, is it hot? Is it humid? Is it dry? What kind of activity are you doing? Of course, the more active you are, the more
water that you're going to need to provide the water for all of those cellular reactions that are taking place that provide the energy for you to do the activity. Wind, temperature, and of course, I think we mentioned altitude.
Mm-hmm.
And also, the presence of chronic disease. Are you taking medications or certain supplements that will increase your demands for water?
Yeah, a lot of medications are diuretics.
Yeah, because there's so much hypertension these days, and people are on these blood pressure medications, and a lot of them are diuretics. But just in general, there's a lot of medications that will increase your fluid needs.
Go over the basic P test hydration. We'll put a chart up here.
Okay,
for
yeah.
this.
So it's the P guide, right? So, so if you've ever, you look at your urine, most of us can tell, like, ooh, okay, that's really dark. That's burnt orange, and you may have been, just been out running or something, or doing something, riding your bike. On a hot day, you come back and it's really dark. Okay, you are dehydrated and you did not do a good enough job during your ride or your run to stay on top of that. So burnt orange means you are dehydrated and you need to get on it quick. An amber color, you need to start drinking water too. It's not as severe as the burnt orange color, but you need to also begin drinking water. Light beer.
It's good.
It's okay. Yeah. You're doing okay. You could be better. The lemonade color is what we consider optimal, right? Mm-hmm. And then, of course, if it's very lightly colored and almost transparent, you are overhydrated. Mm-hmm. And of course, if you have a kidney disease, this is going to throw it off as well. Yeah. And then, of course, if you take supplements, you know that it can turn your urine this fluorescent yellow-green color. And of course, the guide kind of goes out the window then.
Right. And if you had burnt orange and you chug a bunch of water, you will start peeing clear for a little bit. But that doesn't mean you're rehydrated because your body can only absorb so much. So it's going to pass through not absorbing.
I've never had that happen to me. When it's burnt orange and I start drinking water, it's still coming out dark.
Because your body has a certain amount it has to eliminate it no matter what. And if it doesn't get it, it'll pull from the cells and just keeps pulling from you, right? Because there's a minimum you have to, what's that term called?
Oh, you're going to put me on the spot.
Obligatory
urinary output. There is a certain amount of urine that your kidneys have to put out, and it will keep putting it out, and it will start drawing from inside your cells.
This is why you get headaches, cramps.
Versus extracellular water, it will actually start pulling it out of your cells, and that's when things really are bad.
So go through the 10 hydration.
So the signs.
Yeah, we said dark urine.
Yeah. So dark urine's that's a no-brainer right there. A lot of people will have headaches, mm-hmm. And reach for the ibuprofen instead of reaching for the water. And those are the ones that are, drinking a pot of coffee all day long, or stopping by Starbucks 2 or 3 times a day. And then fatigue, you tend to get a little fatigued. You might have some lightheadedness. You might feel woozy. You stand up and you're kind of like, ooh, I feel like I'm going to pass out. You might have an increased heart rate, or feel like your heart is kind of pounding or beating harder than it normally does. Of course, you feel overheated. So sometimes you can feel chilled too. You might start getting muscle cramps. Of course, we mentioned constipated, having trouble, either hard stools typically is the case. And there is a stool guide as well. We won't get into that one right now. And then, of course, dry lips, nose, mouth, tongue. I have a niece who walks around with chapped lips, and I'm always on her about drinking more water. But that is not the beverage of her choice.
Again, she'd rather put on lip balm than...
She would rather just put on the lip balm instead of just drinking the water. So it's just, I just got to keep at it.
And what's the skin?
The skin tartar or the tint sign. I would often do this in the ER. You just pull up a person's skin, and if it fell back into place quickly, they tend not to be dehydrated. But the ones where the skin stays up, not a good sign. Probably dehydrated. Of course, that's not as reliable as we age because we lose a lot of the elasticity in our skin, so it's not so reliable. Then the old people, it's
a little bit
that's
different.
a tough one. Yeah,
But that's another reason why it's such a good beauty tip, because of that skin turgor.
turgor,
Okay.
Turgor.
I have it right here. I still can't pronounce it. Okay.
Yes.
All right. What about urinating at night? Does that mean you're hydrated?
Urination at night. I mean, if you just drank a large amount of water right before bed, you may wake up to urinate.
That was actually an Indian alarm clock. If they had night duty, they would chug a bunch of water, a lot of water, and that would make them wake up in a couple hours so they could get up.
Right.
But in general, you shouldn't wake up. Your body has a mechanism to keep you from.
Yes, your body doesn't want you waking up during the night to urinate. So it tends to shut down that system. Of course, when you're on diuretic medications, that's going to throw it all off. And also, if you have something called HPA axis dysregulation or hypothalamus pituitary adrenal axis dysregulation, and we'll have a whole podcast on that. This comes about because of chronic stressors, and whether it's physical, emotional, mental, or the presence of a lot of chronic disease that puts stress on your body, it causes this dysregulation, and people will get up multiple times at night to urinate. And that's why we ask our patients about this question, because they'll say, "Oh," I'm like, how's your sleep? "Oh, it's good," I'm like, "Do you ever wake up?" "Oh, yeah, sometimes I have to wake up to urinate
3-4 times.
Yeah, or 2 times, and I just go back to sleep." I'm like, that's a sign. I'm going to put that over here, and we'll continue.
Because your body actually has a mechanism to put you to prevent that from happening.
Correct.
All right.
Yeah.
So that, with diabetes, that changes and other things. But in general, that's a good rule.
Yeah.
And with all the fundamentals, folks, it's about a target range because people tend to overdo things. Yes, being slightly overhydrated is probably better than being dehydrated, but you can actually die from if you took the party people who take ecstasy.
Yeah, there's been a lot of deaths that occur from overhydration after using ecstasy because it affects that thirst center, and they become just so thirsty.
So drink a gallon and a half of water.
And that can really, that can cause a lot of electrolyte imbalances, and that's not good for the heart or a lot of your other systems. And so cardiac arrhythmias would often develop, and people would pass away.
Yeah, because folks, we're an electrical system,
and they would overheat too. It's just it's a bad drug.
It's all about balance. But we're an electrical system, and water has to have minerals in it in order to conduct electricity. A lot of people don't realize you cannot conduct electricity with distilled water.
Yeah.
So it's one of the reasons we'll get in a second. It's not a good source of water. So
not for hydration, it isn't.
So that's a good segue. Let's just go through the list real quick. Tap water.
I am not a fan of tap water for many reasons. One, it's hard to trust these days. Mm-hmm. There's a lot of municipal water that is contaminated. You have Flint, Michigan, where the lead was causing a lot of problems, and
it's not just the water source; it's the delivery system.
Right. So that's one thing. And if there's chlorine in your municipal water, and chlorine is there as an antibacterial. Well, there's things that inhabit your GI tract, bacteria, your GI microbiome, which we'll also talk about in another podcast. And what do you think it's doing to those fellas?
Yeah, it's killing it off.
It's killing them off. And also when you're using it to shower, it's killing off the bacteria that live on your skin that protect you.
Yep.
And so I'm just not a fan of drinking it or bathing in it.
And I know bathing's difficult, so don't freak out with that one.
Yeah.
It's better just not to drink the tap water. And it also has fluoride.
And that's a whole other story. I'm not a fan of waste-derived fluoride in our water system. The research that they used to you start putting this in the water system is terrible research. And in fact, they used to use fluoride as a treatment for hyperthyroidism at doses that are often found in many municipal water supplies. So what is that doing to your thyroid function? Because fluoride is in that same category as iodine and bromide. And so iodine is used by your thyroid gland to do what it does. And when you're drinking fluoride, that fluoride will displace the iodine. And now your thyroid can't function as well.
Good for your teeth, bad for your thyroid. Folks, my brother's a dentist. And we always have this argument. It's like, oh, it really improves your teeth. It's like, yeah, but
maybe not.
When we get into food preparation, I'll talk about what's probably the main cause of tooth decay, and it's not lack of fluoride. Okay. Distilled water.
Like you said earlier, no minerals, your body is not going to absorb this water very well. You need minerals in your water. We've always drank water with minerals as human beings. We drank from wells that had minerals in them.
Springs.
Or spring waters. It had minerals in them.
Okay.
And that's your body will absorb that better, and you'll be getting some minerals.
So is well water good? Maybe.
It just depends on the well. We have a well in Colorado that is absolutely horrible.
It has arsenic and 700 milligrams of sodium per liter.
Yes.
You could kill plants with it because it has so much sodium. It actually makes for good clothes and bathes pretty nicely, but it's
right. That's the only thing we can use it for. We'll still have to have drinking water brought in from somewhere else, but that's what we do here.
So you have to have your water tested, and we'll get into testing your tap water, but you also need to get your well water tested. Alkaline water.
That's mineralized water.
Exactly. That's just because the calcium and magnesium range the pH. Right. That's alkaline.
They make it sound so fancy and like it's some type of magic. It's just normal water that has minerals in it.
Water with a squeeze of fruit.
I'm fine with it. It gets, if anything that can help people drink more water and less of the other stuff. There's some people that come to us and I don't like the taste of water. That's because they're so used to drinking colas and coffee and anything but water. So I will have them put a squeeze of orange in it. Maybe fill up a container of water and put some blackberries or blueberries or something, just a hint, or some lemon, just a hint of some sweetness or a taste. And that typically works. And it's refreshing. I like it with cucumbers.
Yeah. And I'll tell you that mineral water tastes a lot better than regular water.
It does.
We get our water from hot springs that
it's great water.
We drink so much more because of it, because it tastes good.
Yeah.
And we're not against tea and coffee. If you drink it, it should be organic. Believe it or not, those are two of the heavily sprayed with fungicides and pesticides and herbicides. So you need to get organic tea or coffee if you're doing it. But is that good for hydration?
It depends on what kind of tea.
Right.
Not all the teas have caffeine.
Right. So white has the less, green has a little bit more, black has the most.
And I'm fine with teas because I have a lot of antioxidants in them.
As does coffee.
As does coffee. And coffee's a different story. It's a little bit different than the teas just because it tends to have more caffeine. And that's not good for some people during certain stages of their life.
So it's a treat, but not a hydration.
Right.
Kombucha.
Kombucha.
Too much sugar.
It has a lot of sugar. It can be good for your gut health because of all the beneficial bacteria that it has. But there's a ton of sugar. So you could drink it for your gut health, but you wouldn't want to be hydrating with it. Okay. Would not be your primary hydration tool.
Coconut water. I lived on coconut water when I lived in India for a year and a half, and it's you can't trust the water there. It's worse in Mexico. But the green coconut is excellent, and
I love it.
Yeah, and then the canned stuff, typically that's starting to be a little bit more ripe and has more. Sometimes they add sugar, so be careful with that.
You really have to look at the label on the coconut waters that you're getting, and sometimes coconut water. Some people can't. They're allergic to coconut, or I've had people say, "Oh, it gives me diarrhea," so it makes me kind of think, "Oh, do you have some yeast overgrowth in your gut because of the caprylic acid content?"
We talked about it. It would have some. The caprylic acid increases as the coconut matures, so it's in the coconut fat, which would
versus,
be the green coconut is it's ripening into a brown one, and the water gets converted into a hard substance. But
I've had to do that to me at various times in my life when I've suspected that I may have been eating too much sugar at that time.
Yeah.
So I don't know. It's an interesting theory.
People overestimate or underestimate the amount of water that foods have.
I know fresh fruits and vegetables have a lot of water. Even a steak does.
Yeah. Beef jerky, not so much.
Exactly. But a nice juicy steak, watermelon, berries, squashes. I mean, those things have a lot of water, and they can contribute a lot of water to your daily needs.
There's a recurring theme you'll see through these fundamentals is people think, oh, it's going to be eating kale all the time. Like, no, we eat a good, balanced, fresh foods, but they're delicious.
But if you're eating a bunch of processed foods, there's no water in those.
No, it's junk.
You need to be eating the freshest fruits and vegetables you can.
What are the bad sources? I mean, Gatorade's great, right? Food dyes.
Don't get me started. So I'm not a fan of Gatorade or the Powerades. First of all, a lot of them have sugar alcohols in them, and food dyes.
Yeah.
No. Food dyes are not good for your gut health. And food dyes can make your kids act crazy. I can't tell you how many moms have told me this, and I have witnessed it with my own eyes in family members and friends' kids.
Yeah. You want to make your own Gatorade, get a good clean source of water, put a little bit of sugar in it, a little bit of Himalayan pink salt.
Mm-hmm.
There's your electrolyte. The glucose helps recovery. This is a sports drink, not a hydration drink. This is your sports drink.
Yeah.
That way it's cheap. It actually is much better for you. So water, I mean, a few grams of sugar, not much. And then a good pinch of Himalayan salt, and that's an excellent sports drink.
Right.
What about artificial sweeteners? Now, so without sugar, then it's good, right?
Yeah. Yeah, the sugar alternatives, especially the sorbitols, the xylitols, and things like that, they are not beneficial for your gut health, so I don't like them. Of course, aspartame and Sweet and Low and Splenda.
They'll spike your insulin, believe it or not.
Those things are horrible for your gut health.
Yep.
I see a lot of diabetic patients, and even when I was a dietitian, we were taught to tell our diabetic patients to use this instead of real sugar. Well, it was destroying their gut microbiome. Actually, I've had patients who had fecal incontinence because of the amount of artificial sweeteners that they were consuming in their colas. I had one lady who was diagnosed with stroke. She thought she was having mini strokes, and she had aspartame toxicity.
It'll also mess up your hunger cues because when
it does spike some people's blood sugars.
Well, think about your body. Taste something sweet. Your brain says, okay, we ingested sucrose, glucose, fructose, something. It sends a communication to produce insulin, and that insulin is in there. There's nothing to mop up, and then that causes hunger.
It causes inflammation in your gut, and that tends to what spikes the blood sugar and causes the hyperinsulinemia response. But even with not monk fruit, but stevia has been shown to also spike people's blood sugars. So you kind of be careful. And I just want people to get away from everything having to taste so sweet anyway. Why does everything have to taste sweet?
Well, your taste buds acclimate. So the American diet's acclimated our taste buds to super sweet.
Salt, sugar, fat.
And if you acclimate your taste buds, it just keeps on upping the level that you need. The reason a child cannot eat or does not like to eat a lot of vegetables is because their bitter receptors are so intense.
Not all of them, but a lot of kids.
But the same thing occurs if you start bathing the taste buds in sugar all the time, it takes more and more and more to satiate it. So
sugar's addictive, that's a whole other topic.
Yeah.
So other things you want to probably stay away from that are not great for hydration. Alcohol. Okay. Most of us know that one. That will dehydrate you very, very quickly because of alcohol's effects at the kidney and what it does to that. It blocks something called aquapores, I believe. Energy drinks. No. I can't tell you how many teens, young adults, and even older adults I've seen in the ER with heart palpitations and cardiac arrhythmias because of the energy drinks. Yep. The Mountain Dews, they're just drinking Mountain Dews and energy drinks all day long, and it is causing major issues in the heart because of a lot of things that are in that, not just the caffeine.
So let's talk about how we can find good sources of water. We already said that tap water is not good because of chlorine and fluoride. But how do you know if it's contaminated? Well, we'll put up a chart right now. There's a website, ewg.org/tapwater.
And that stands for Environmental Working Group. It's a really good resource for a lot of things other than just water quality. Mm-hmm. But I like to go them because you can actually type in where you live and they can tell you about the quality of your municipal water.
Yeah, I typed ours in. We exceeded EWG on 10 contaminants, and there were a total of 21 contaminants in our water. And that's not counting fluoride and chlorine.
I know.
So now you can use municipal water, and we'll get into this in a second and to remove it, but understand what your water is, and also understand how old your house is. If it's a Victorian home, you really need to do the test from the tap, because the delivery system might be the issue, not the source.
Right. Yeah. If your house has lead pipes, of course, that's a problem. But even if you have a newer home, that doesn't mean that the city's has replaced
The delivery lines.
their delivery lines
Yep.
as well.
Whatever the weakest link is what you're going to be receiving. Bottled water, yes, I'm not going to throw it out completely, but they're shipped in trucks. When plastic gets hot, it leaches the chemicals into the water, and there's no quality control when they're shipping these waters. So I don't know if you know, a tractor trailer, we have to ship a lot of things in for our business, and a tractor trailer will get 40, sometimes 50 degrees hotter than outside. That means that water is getting to 140, 150 degrees. That's leaching a lot of plastics back into the water. So that's not good.
I don't like, plastic bottles. I just am not a fan of. I would always choose glass.
Yep. We already talked about well water. It can be good, may or not. I will say this, just anecdotally, I had some old timers about a garden. They'd always say, well, well water keep your garden alive, but it won't thrive. And so it's part of that's the mineralization, but they call it dead water.
Mm-hmm.
Just have your well water tested if you're on a well, make sure it's good.
And another thing about the bottled water, the reason I'm not a fan of the plastic water bottles is because the plastics that contaminate the water or whatever beverage you're drinking out of the plastic, these act as estrogens to the body, and some of them can be not only estrogenic but quite toxic, and they can build up and accumulate in your body and start disrupting a lot of hormonal pathways.
Is that man boobs?
And endocrine. Yes, Paul. Gynecomastia is a possibility, but it can really throw off your body. These petrochemicals, because they come from gasoline.
Yeah.
Sources.
Now, and plastics is kind of a gradient on what's the softer the plastic, the worse it is. You get up to your Lexan, which no one's shipping water in Lexan, but they know those plastics are pretty inert, not quite as good as glass, but there are some high quality.
You still would not want to cook in them or heat in them.
No, but you can use it as a water bottle because glass can break. But it's the hard.
As long as the water's cold.
And use a hard plastic.
Right. So I will give you that.
Okay. Well, how do we get our well water or our tap water to a state where we can drink it if it's too expensive to get? Because, we had water shipped in for a while and we stopped because it was so expensive. Right. So now we drive once a month to Hot Springs. We have a bunch of 5-gallon bottles. If you heard that was our dog in the background. Yeah. So there are filters that do well. Even a Brita filter is decent. It gets rid of lead, arsenic,
a lot of contaminants, but
chlorine. It gets rid of the chlorine.
But it will not get rid of fluoride.
No. And even the really good ones like Zero Water, or I'm not even saying this is a good one, but they claim more, or the Berkey filters.
Mm-hmm. The Berkeys can be expensive, and
we're not sure. They claim they get rid of fluoride, but it's still...
And you have to kind of babysit them and make sure the filters don't dry out. And you can't go on 3-day weekend trips because they will dry out. And it's just, I finally ended up giving mine away to a friend.
But they are good filtration systems. So research one's the best for you. If you're going to use something like that, and if you're going to use an RO system, reverse osmosis, both those type systems remove everything. And remember we started this conversation, we said distilled water is not good. Well, that's not quite distilled, but it's removing all the minerals. So if you're going to use an RO system or a Berkey that removes almost everything, use a pinch of Himalayan salt per liter. So a pinch of I like the Himalayan because it has sodium, but it also has a lot of trace minerals. And that's a cheap way of remineralizing your water after you remove everything. If you're going to use an RO system or something that removes everything. The Zero system has a little meter. It says, look, there's no dissolved solids. Okay, that's not great either. So you have to add them back in.
And again, the place to look and compare filtration systems is that website that we had mentioned earlier, ewg.org. And you can go through all your options and see which one is going to fit, your needs and your budget, because there's a huge range.
And folks, we're not, other than no high fructose corn syrup, no food dyes, we're not saying you can't. Artificial sweeteners. Those are the hard no's.
Yeah.
But
caffeine isn't. It shouldn't be caffeinated. It's going to dehydrate you.
But a cup of coffee in the morning is not a bad thing if it's organic.
Well, as long as you're going to make up for the deficits during the day.
Exactly.
Yeah.
So we're not saying.
But you can't walk around all day long drinking coffee.
I understand, but I'm saying I don't want to think the fundamentals is all about a sustainable health lifestyle. Because if you push it too far, you're not enjoying yourself, then you'll rebound and go back to your bad habits. So it has to be something that's sustainable. So organic tea and coffee, good, as long as you understand it's not hydrating you. No high fructose corn syrup, no artificial sweeteners, no food dyes. A cocktail here and now is probably not the end of the world. Again, it's not good for you. The whole resveratrol in the red wine was they actually had to quit saying that because it was no longer a truth. But I don't want people to think that they're going to set themselves back to zero if they.
I just want people to start drinking more clean water and stop it with all of the colas, coffee, teas.
All day long.
You have to start paying attention to this. You need more. It really is that important to the health and function of your body.
Balance and everything, folks. All right, that's hydration. We will talk to you soon.
Bye, guys.
I don't take nothing that a doctor don't prescribe. I don't do no drugs, man. I don't do no drugs, man.